And welcome back. Health People is a groundbreaking peer organization that's actually helping people from low-income communities become leaders to effectively fight chronic ill health. Their mission? To empower and train residents of communities overwhelmed by chronic disease, as well as HIV and AIDS, to become leaders and educators in effectively preventing ill health, avoidable hospitalization, as well as unnecessary deaths. Health People has grown to become a multifaceted health agency offering a range of HIV and AIDS services for men, women, and families, as well as prevention and support services for hepatitis C, mental illness, and substance abuse. And with recent reports indicating 12 New York City neighborhoods with COVID-19 positivity rates that have actually risen above 3%, what initiatives has the organization taken for COVID outreach and prevention? Well, we're pleased to be joined by two very special guests. Our first guest is the Executive Director of Health People, Chris Norwood, and also our second guest is also the Executive Director of the Bronx Public Health Office at the Department of Health and Mental Hygiene, Anita Reyes. And we thank you so much for joining us.
Thank you. Nice to see you.
Thank you. Thank you. And then, Chris, I guess we'll start and talk a little bit about Health People. I gave the long version, but for somebody who wants to be more familiar with Health People from layman's terms, go ahead and take it away.
Okay, thank you. I think what is the most important thing about Health People, we know the Bronx has the worst health of any county in New York State. But in working with the community, we've shown that the community can make so much progress against this. We started as a women's AIDS organization, and women just went out there. They did so much prevention, and women's rates have gone down. They also work with men. We do a tremendous amount of diabetes now. That's also very important for the COVID epidemic. We train people from the Bronx who have diabetes. Their family members have diabetes. They have put almost 2,000 people in evidence-based diabetes self-care education. That's the most any community group in New York State has ever done, possibly the nation. When they went into homeless shelters, they brought down, for people with diabetes, the rate of emergency room visits by 45%. So to me, the message is that when you help the community, educate the community, and have them become the educators, they know how to reach people, they know how to talk to people. You will make such progress, and we should stop being depressed about this and demand community models that work.
Yeah. Anita, give me a little bit about the borough of the Bronx. I mean, particularly, a lot of education is going on, but a lot of work is going on, and we've seen some very fruitful results recently.
Yes, definitely. And so the work that I've been doing and my team here in the Bronx is really working closely with the partners in the area to make sure that we understand the community and also understand the needs of the community. And so therefore, we've been doing a lot of engagement. We're currently contacting partners and community residents to understand what the needs of the community are. So giving information, like answering questions, making sure that people understand how to maintain themselves safe. And so basically focusing on the 4 core things that are making sure that everyone is wearing a face mask, making sure that folks are keeping 6 feet distancing, but also washing the hands is something that could prevent, from getting COVID, as well as if you're sick, just stay home and get tested so you could know if you have COVID. So really, we're working to make sure that people understand these messages, that people know that all our centers and the health and hospitals, clinics offer free testing, COVID testing.
Mm-hmm. And when we talk about self-care, I think everybody needs to be engaged in self-care. When we talk about wearing a mask is self-care. We talk about hand sanitizer, that's self-care as well. But talk to us a little bit about the work that you do in terms of prevention for chronic diseases with HIV and AIDS.
Well, with HIV, we do a lot of outreach. We also do, as we do for diabetes, asthma, and other chronic disease, we do self-care courses, actually, courses that are usually 6 sessions long, so that people can really have an opportunity to ask all their questions and make sure that they understand things very well. Also, when people with HIV, as you probably know, but it's worth emphasizing, when they're in care and they take their medications, they almost they're not going to transmit HIV to other people. If they get in good self-care and good control, then the virus goes down so far in their body that there's very little chance they'll transmit it to other people. So, you know, in the same way I said for diabetes, we see people flocking to self-care courses. Unfortunately, the federal government and the state government defunded those right now when they're so important and important for COVID. But we see when you put serious education and people know you're respecting them and giving them what they need to know and giving them a chance to ask their questions and understand it, we've seen HIV go down. If we had more of this diabetes education, we would see that go down. And at least in the Bronx at this time, as we say, we shouldn't get complacent, but it's very satisfying that the infection rate for COVID in the Bronx has been brought down tremendously too. And the communities and public deserve a lot of credit. You know, they want this information. So we and the Department of Health try and give it to them.
Let's talk about that. And Anita, I think you can jump in and talk a little bit about this too. When we talk about the Bronx actually having that highest infection rate, but then at the same time, we also see that we're doing a great job in terms of dealing with, you know, new infections and things of that sort.
That there are a number of reasons why the relative success of seeing the Bronx you know, numbers decrease. But, you know, first and foremost, we have to thank the people of the Bronx who are really stepping up and doing what they're supposed to. And we do know that this is partly because of what we saw back in March and April. So right now, following the guidelines is amazing, right? Amazing work that the residents are doing, but also working with our community partners. And our partners have really helped because these are trusted entities in the community that are able to really share the information, share the message, help with ending this transmission. But I also have to say that the 17 years of our presence here in the Tremont section of the Bronx really have helped us collaborate with others and being able to kind of, you know, be trusted amongst our partners. And I also wanted to just mention that we cannot do it alone. We need everyone. This is all hands on deck. Let's go out. Let's get the information to everyone. And I think this is what's going to help us. But I also do want to stress that we cannot let our guards down, right? We have to continue doing this. We have to continue asking people to wear masks. We have to make sure that people are social distancing. When I go to the supermarket, I'm the first one to say, excuse me, sir, 6 feet away. And so you have to remind people, and that's my job because I want to make sure that everyone is safe. But at the same time, we also have to make sure that we know our status. There's free entities in this neighborhood. We had two different approaches that we've used, which is the hyper-local approach, really using data to drive us to where the problem is. And so with this data approach, we're looking at our data to see where there's neighborhoods that have positivity rates and are have low rates of testing. And these neighborhoods, we're doing these hyper-local efforts. We want to flood them with information, but we also want to flood them with testing. And so in the Tremont area, the Soundview area, we've been able to do that, working together with H&H, City Hall, and other city agencies to really bring everything to where people are. So it's just public health in action, right? We set up at a Catholic church, St. Simon, over on 182nd and Valentine Avenue. And there we just set up shop outdoors. We were able to stop people and get them tested. And the good thing was that within 15 minutes, they were able to get results. So it was rapid testing. And that really helped in terms of identifying anyone that was positive. So I just want to stress the importance of that and also the test and trace work that is going on. It's very important. And the test and trace is really trying to get the community to get tested so they could know if they've been infected. If they're infected, then immediately they'll get a call from someone to help them navigate through, to help them understand the resources that are there, but also to understand where they've been. Have you been with other people? And you know, people who are newly infected, who get a test and trace call, what they're really asking them is, can you identify where you've been for more than 10 minutes so that we could stop the spread? And that is the goal. So when I hear the word trace, I want to make sure that people don't think we're tracing you per se, we're tracing
Which is
the virus.
Right, right. Hey, Chris, before we go, talk to us about what's happening in the future and how people can get connected.
Education, that sounds so corny in a way, education, but it's self-care education, and it works so well. For example, the diabetes prevention program, if people have high blood sugar, it's well proven. It reduces people's chance of getting diabetes by 60%. That's better than flu vaccine. Flu vaccine is like 40 to 50% effective. So we really need to move for chronic disease, for AIDS. For COVID, it's a combination of education and testing, and obviously very important, sometimes new medications if you do get sick. But for chronic disease, people just need to understand, our food supply is so sugar laden. One of the most important things we teach is to read every label, because you'll be in a state of shock. And even much salad dressing, the first ingredient is sugar water. And people are like, great, I'm going to be really healthy now, I'm going to eat a salad. And then they don't know, and it's not fair that they don't know that what they're putting on top is sugar water. So the education is key.
Yeah, education is key. It's so critical. I think the more people are armed with information, the better that they can make informed choices. As we've seen right here, when you have the highest rate of infection, but then at the same time, also we see we brought it down the most as a borough of the Bronx. That's something to be proud about. And so, Anita and Chris, thank you so much for being with us and sharing with us here on Open. And we thank you for joining us.
Thank you. And just want to invite everyone to come and get their free vaccines. We're going to have free vaccination at our Action Center, 1826 Arthur Avenue on Wednesday, October 7th, from 10 to 2 p.m.
That's flu.
Very important. The flu vaccine.
Right.
Right.
I'll be there.
Okay. Well, we want to make sure that people do take part in getting that flu vaccine. And also, we want to let you know, if you want more information, what you can do is go to the website. And the website is healthpeople.org or nyc.gov/health. Well, we encourage you, stay with us. Don't go anywhere. We still have more Open coming up. We'll be back with another segment right after this.